Hi, so this is for my partner training. Rather than doing a full sequence for the Thai massage, I'm simply going to mark. So if you remember from our training, we talked about the pouring of weight. So having your arms straight, your back straight, and not necessarily touching your partner until you have really centered yourself, grounded yourself, and focused your heart and mind on your partner. And so some of the cues I generally use when teaching Thai massage is allowing the person who's receiving to completely relax, letting their limbs grow limp, and then as the giver is the one who is watching the receiver's breath. So I'm moving in response to her breath, and I'm pouring my weight really side to side in response to her breath. So it's slow and controlled. But for the purposes of training, we'll do supine, and I'll just be marking. So meaning I'm just going to trace so that you get an idea of the sequence. But then you can incorporate what's a little bit longer. So I would begin with centering, might rub the palms together, feel the energy in the hands, and then gently place my hands on my partner's feet. And I would thumb circle 3 times in one direction and 3 in another. Perhaps I scoop underneath. I would give her some plantar flexion, so notice the kneecaps point up, plantar flexion 3 times pressing down, circle the hands around, dorsiflexion. Notice that I'm using my hara or my navel center as I press my weight forward and then rotate her to the outside. I might make another traction and adjust out and open up for enough room for space. Then we do elephant walking or palming. So I would follow the inside of the shin bone lines, and I would simply come up to my kneel diamond stance, so balls of my feet, knees slightly apart, so that I can lift up or back. I would palm right and left. So for marking purposes, I might palm all the way up to the knees, pause at the knees, and knee circle. I would move into half kneeling, right or left foot, and I would simply palm all the way up to the blood stop. Once I get to the blood stop, which is really where the crease of the hip meets, I would pour all of my weight down. If I need more weight, I might lift the back knee, or just again, stacking shoulders over wrist until I feel my partner's pulse. Once I've held it here from anywhere from 5 to 10 breaths, I slowly release, and then I follow the blood and trace it down the leg, and she feels a rush as the blood releases. Then I'll palm or elephant walk all the way back down, perhaps knee circle, and palm again. I'll scoop my hands underneath her heels, moving them to my lap. And then I might get her to nod yes. Yes to anything I ask. So the chin moves up and moves down. I lift the legs. I take my fingers sort of in a little Spock grip. So one finger comes underneath and the thumb supports. I knee walk forward, slide my knee underneath hers for sacral float. I use my fist instead of the palm of the hand down to adjust my own body if I need to move forward. So noticing the length of our legs might be different. If you're not able to get her sacrum off the floor, then maybe I have to go up to the ball of my foot. Otherwise, foot is flat. I'll take foot over foot so that the arches of her feet come together, and as I push down, her sacrum should come off the floor without her having to lift herself. If she's got to lift herself, you know you haven't got her off or relaxed, so you would encourage her to relax. And then I would just move from my belly or navel center till I can feel her swing softly. Perhaps even add a little bit with my opposing arm. I release her down. I take my hands underneath the calves, pull her knees toward her chest, and then I extend the legs. Notice that I don't straighten them until my knees come to her knees, and then I straighten the legs. I can offer bus driver, so knees out, and a little side to side, so a lateral stretch to the side of the body. I can also take here bullfighter, so I can straighten the legs one at a time, step one leg forward, lift my heart, internally rotate her feet, and lean back. But notice as I lean back, I'm also getting a stretch for myself. And then I shift the weight all the way back down. I can either swing her legs side to side, circular motion, I can get really fancy and drop the legs down, or I lower them all the way down to the ground. Once I come down to the ground, I'll brush her legs off 3 times. You can also walk around. You can use cat palming. So cat palming on the top of the shoulders, which simply means that I'm pressing on the top of the traps as opposed to on top of the chest. So I would alternate here, and if I could get a little deeper, if I didn't have a wall, I would sit even further back. My fingers come underneath. I find the occiput, which is where the ridge of the skull and the neck meet. My fingertips come underneath. I traction the neck toward me, gliding it toward me. And then as I release, I'll glide my fingers out. I might give them a little shampoo. Thai ladies want it nice and firm to wake you up. And then I'll just gently place my hands on top of her shoulders, and I'll close it in Namaste. And that is the supine sequence.